This module is about survey research, which may seem a bit familiar given the work that you're doing right now in locating data sets to answer your research question. Survey research is the most common method of collecting data. This is typically done via what we can call a questionnaire, a survey. It's also called a scale or a measurement scale, or some kind of standardized interview guide, but it's a series of questions or statements that you're asked to respond to that are standardized and systematic across a number of questions or topic area. There's two kinds of surveys that we're going to think about today, and one is cross-sectional, which occurs during a single point in time. One-time assessment of health or one-time assessment of your perspective on something, or longitudinal survey. And so this can occur either with the different populations over a period of time or the same population over a period of time. Descriptive tends to be more cross-sectional. So if our goal is a descriptive study, we tend to have more access to the cross-sectional types of research. But if we want to do more explanatory and in-depth inferential research, we can have both cross-sectional and longitudinal surveys and use that for more in-depth analyses. So just to give you a brief overview about a cross-sectional survey, it can be retrospective, it can be prospective, or it can be current, so what's happening right now. But it's very specific to a single point in time or specific period. And again, descriptive studies. So when we're seeking to describe something, we typically are using a cross-sectional analysis or a cross-sectional survey. Often what you're doing is if you're looking at a large data set, it'll be 1 year of that data, for example, a cross-section of that cohort. Now, conversely, what you're seeing a lot with multiple years of data are longitudinal surveys. So longitudinal surveys are those that are conducted over a significant period of time. And there's generally two types of longitudinal surveys. So those are trend and panel data collection approaches. So the trend longitudinal survey is that which contains the same variables with random samples from the same population. So it's asking the same variables over time, and there may be some overlap, so maybe the same person will get picked again, down the road a few years, but it's supposed to be a random sample from the same population. So the National Health Interview Survey is a good example of that. Panel data or panel cohorts are representative of the sample of the population of interest. So that is the same population over time, but at specific time intervals. So that's the things like the Medicare Expenditure Panel Survey. MEPS is how I know it. So sorry, it's a mouthful. But that is representative of the population of interest. So you're looking at the same population over time intervals versus the same information or trends in certain risk factors within the same population over time. But essentially, there's three major elements when we're thinking about survey data. So what I'm going to do is I'm going to cover primary data first. So let's say you're conducting your own survey, and then we're going to talk about utilizing the data from a survey as secondary data. There's three basic areas: planning, administration, and analysis. I will repeat this often. Do not write your own surveys if you can avoid it at all costs, because it is extremely challenging to write good measures. People dedicate their whole careers to psychometrics, which is the study of validation of measures or scale development. So there are many exceptional scales and validated questionnaires that can answer a huge range of questions. So I strongly urge you to always look out there first. If you are really, really keen on collecting primary data down the road, I would definitely look for questions that are already out there instead of creating your own. So this may look very familiar in terms of research design. You have your research question, you review your literature, and you consider frameworks. You select your unit of analysis. And the difference here is that you're assembling the survey instrument. So you've already used the literature to validate the fact that this is the survey that's going to get you as close as possible to your research question. And you may have adapted some of the questions. You may have cut some of it, for example, if it wasn't relevant to the population you're interested in. But some of the important considerations that you need to think about are, how are you going to field this survey? Are you going to sit in front of the person and just ask them the questions and fill out the form yourself? Are you going to hand them a piece of paper and pencil? Are you going to do it via an app? Are you going to call them on the phone and do, are you going to call them on the phone and do the survey? Or are you going to allow them to self-administer it? Are you going to supervise them? Are you going to be in the room with them? All of these things are evidence-based, and there's a great deal of literature behind the different approaches that you can utilize. But once again, I urge you to consider the unintended consequences and the underlying assumptions of your population. So more than anything, I want you to think about, what is your population? So if you're targeting, for example, an older adult population, you probably want to make sure that they understand the questions, that they can read the questions easily, or that they can hear them if that's the case. You also want to make sure that if you're targeting a vulnerable population or a limited English proficient population, then that you've taken the appropriate steps to properly interpret the questions or translate the questions, versus simply putting them through, for example, Google Translate, which may seem sufficient, but it is not. So these are all the things that you need to really think about before you begin to easily engage in what you may think is something that's a very simple process, because it does begin to get more complicated. Dillman and colleagues is one of the most preeminent survey methodologists in the field, and has written extensively about the best modes, including recent updates with respect to utilizing cell phones, as well as email survey development. So if you are interested in fielding your own surveys, this is definitely the person to read up on. Other things to really consider are things like, who is going to be asking the questions? If you are going to have an interviewer, you need to make sure that you're thinking about, how are the interviewers going to ask the questions? Are they going to ask them in person? Because one of the key elements of a survey is that it be systematic. So what does that mean? Well, that means that your interviewers need to be asking the questions in the same way, at the same time, with the same follow-up questions, for example. So you have to make sure that they're not asking additional follow-up. Make sure that they're not asking, for example, in a leading tone or things like that. If they're asking probing data, you need to identify what probes. So for example, if they're asking about a personal topic, that they can only probe so much and not more than that. Also, again, think about the sampling. Are you sampling the right population for the questions that you're asking? So I did talk about the underlying assumptions, where they're located. So are the people that you want to survey, are they representative of the population that you're targeting? And most of the time, even in the hospital, you will have to get IRB approval. It just depends on whether or not it's for quality improvement purposes. So if it's internal, or if it's something that you're going to roll out further. So it all depends if it's research-based or QI. QI, you typically are okay with not getting IRB approval, but you always want to make sure. Another thing you want to think about is, if you are using this for research, how are you going to ethically, safely, and successfully recruit people to answer your survey? So for example, if you are trying to survey people at different clinics, you can't offer each person $1,000. Because first of all, that's a lot of money, and you are likely not to be able to afford that in your study unless you're really well funded, and then I want to know who's funding you. But also because it's very, and now I'm blanking on the term, of course, but it's actually, it's unethical to pay a volunteer such an amount that it's considered, oh my goodness, I'm blanking right now, but I will tell you in just a minute. Coercion, thank you. it's considered coercive, which means that you're essentially not necessarily forcing them to participate in the research, but you're making it so enticing to such an extent that you can't say no. It's like too good of a deal to pass up. And that is also unethical in terms of, for example, if a person is low income, or if a person, this occurs in, for example, incarcerated populations for privileges, and in, these types of ethical violations are very closely monitored too for populations with alcohol and drug abuse populations and things like that. Lastly, the thing you want to think about is, do your non-respondents, the people that are not participating, do they look like the people that did participate? Because, for example, if you are targeting adults over age 55 and only adults under age 55 participate, then you've basically missed the entire target population. So you want to make sure that your sample is balanced, and this is where you get into things like weighting, stratified sampling, and non-randomized sampling, because you want to make sure that you are representative of the population that you're interested in, and that you're not introducing measurement error, which is unnecessary bias, selection bias, into your study. At the analysis stage, we will talk a little bit more about statistical analysis down the road, but you really want to think about diagnosing your data, looking at the distributions, the frequencies of each of the categories, and again, what's missing. Because again, all of this is not helpful if you didn't do a good survey at the beginning. So that's why I strongly encourage always using a well-validated survey that's been around for a while, because it's also something you can compare it to, right? But if you do run into some issues with your data, there's a lot that you can do with your statistical approach. So for example, always start with simple measures, but you can begin to impute data in the event that you have missing data. It's also important to look at the distributions, because depending on how skewed and kurtotic, you're not going to look at the mean, you're going to look at the median. You're not going to look at each category, for example, you're going to aggregate the categories. So that's why when I talk about the raw data, you have to diagnose it first. And we'll go much further into that. And this, of course, is nothing without your code book, right? So if you guys remember from previous lab, we have our code books, which we'll talk about in more detail as well. But it does lead us into the benefits of secondary data, right? So survey data that already existed before you came along is considered secondary data. So if, for those of you that have already been looking around at the National Health Interview Survey, BRFUS, the Behavioral Risk Factor Surveillance Survey, the American Community Survey, the census data, Medicaid, SEER, Medicare, all of administrative and clinical data sets, EHRs, these are all considered secondary data for the purposes of either they existed prior to you using them, or they had a prior purpose before you decided to use them for whatever analysis you were using them for. And that's that's like billing data and claims data. So that's what secondary data is. And that does lead us to part two. We'll be using this same group, this video, for the next 2 weeks, but I wanted to cover both. And basically, and I got ahead of myself, but basically you're analyzing data that's already there. Which means that you didn't really have a say in what was, how the methods to collect the data were conducted. So you are working with what you have, right? And again, there's the same, very similar types of secondary data. The big difference is that it was usually used to answer a different research question, right? And there's a few general types of secondary data, because secondary data, like I had already stated before, can come from a lot of different sources. So we're talking specifically about survey secondary data. And again, that can be trend and panel, but it can also be cohort, right? So, and that's not as common, that's usually used for research data, but it is because it's very expensive. That's the only reason, because cohort data is wonderful, but again, it's very expensive. And secondary data in general are better because they are more economic, they're publicly available, and there's a lot of samples. So when you think about secondary data versus primary data, you could probably get, you know, maybe 50 interviews, and that's exhausting. That's a lot of sample for one person to get. But when you get secondary data, you can get thousands of records because somebody's already collected them, or they're collected over years. So again, they may not answer your research question exactly, but they do play an important role in helping you understand either your independent variable better, your outcome variable better, or some kind of conceptualization or contextualization of your research question. That's very helpful. One of the most important things about secondary data is to think about data stewardship and privacy, because even though these are publicly available data sets in many cases, these are still someone's responses. This is someone's information. So be very mindful of that. And I think it's really important to never, ever forget that, regardless of what you're doing when you're thinking about somebody's information, because these records are people. So when we do think about the analysis of secondary data, it's even more important to look at the raw data, to look at the frequencies and distributions, because you need to know what you have. So you're getting to know a brand new data set that you've never met before. And this should start looking very familiar with what we've started doing and we're doing. So we're already looking at raw data. We're looking at frequencies. We're looking at distributions. And we're going to start cleaning and recoding and doing what's called a sensitivity analysis when we recode to see how do we make these variables work for us and match to our research questions. And then below that, I've given you basically the statistics that we're going to do further down in the semester. But it's basically the statistical process of the descriptive studies and the explanatory studies. So simple regressions, simple multivariable models, simple descriptive tests that we'll look at to select our models. I just said that backwards, but basically that's kind of the continuum of the data analysis and data management continuum. And that's about it. So with that, we'll actually dig right into the data.